Gloves are like an EMT's bread and butter. We use them on every call, but it didn't used to be that way in the medical field. In the 1890s, surgery still had a 50% mortality rate, mostly due to infection. Surgeons didn't even wash their hands in between patients. So even if surgery was a success, they probably still died. So they started disinfecting instruments with chemicals. Not like the ones we have today, but you get the idea. The scrub nurses would touch the instruments all day long, which led to contact dermatitis, or a really bad rash. A man named Dr. Lister thought his scrub nurse was pretty cute. So he reached out to Goodyear Tires and commissioned them to make a rubber glove to protect the hands of the scrub nurse. Eventually, they started disinfecting the gloves as well. In 1964, they came up with the first disposable gloves. One wear and throw it away. So the question is, why do we wear them? Well, we wear them for two reasons. The first is patients love to cough and sneeze and hack and get gross stuff all over you. And the second is, you're just as likely to have all those sicknesses as they are. So we want to protect the patient from you and you from the patient. Gloves are what we call minimum protection in EMS. We wear them on every call with every patient contact. They help protect us from visible threats, like bodily fluids, as well as unseen dangers, like viruses. They can either be latex or vinyl. Just as important as wearing gloves is taking them off properly. You want to make sure that you take them off properly so that you don't spread contamination. You want to start by grasping the glove on one wrist, making sure to only touch the outside part of the glove. Pull it over just past the base of your thumb. Once it's there, you can switch hands and grab the wrist of the other one. Again, you only want to touch the outside. You can pull this glove completely off towards the fingers. I like to wrap it up in the other glove. That way I'm not touching it again. And then, grasping the inside of this glove, you can pull the gloves off completely. And there you have it. You took them off without touching the outside. This right here is exactly what you don't want to do. See how he gets whatever's on his gloves all over his wrists? Whenever there's a risk of excessive contamination or bleeding, you may want to wear two sets of gloves or double glove, or you might want to wear a pair of vinyl or latex gloves underneath a pair of leather gloves, depending on the call. Whether you work for an inner-city agency with a high call volume or in a small town, gloves are the best way to protect yourself so that you don't end up quarantined.